On Friday morning, the Deputy Speaker of Parliament, Jacob Olanya, called for a special sitting for members of Parliament to discuss the way forward over nodding disease syndrome in northern Uganda after it had been declared an emergency on Wednesday this week. A supplementary budget has been approved to cater for the care of the victims of the disabling condition, most of whom are children. It is estimated that the two worst-hit districts of Kitgum and Omoro require 1.2 billion shillings a year to cater for the food supplements that boost the immunity of the affected children. However, a letter written by Dr. Diana Twine, the Permanent Secretary in the Health Ministry, changed the mood of the plenary because the lawmakers and the Deputy Speaker thought it undermined their decision. It led to the adjournment of the special sitting after less than 20 minutes.
This House cannot proceed with business. House adjourned.
This is what members of Parliament had to say.
After the House resolving that we should find money immediately as an emergency to service this case, this letter is coming from the ministry. And this letter is asking the Minister of Finance to find money in the budget of 2018-2019 to handle the issue of nodding syndrome. But it does not talk about emergency.
We have just passed a supplementary here. Billions of shillings. Why can't we get this money to help these children? If this was happening in another place, possibly it would be a different.
Where we see this minister and even the permanent secretary being heartless, callous, and speaking with I don't care attitude.
Lawmakers also vented their frustration with how decisions are made in the country.
To a tune of 29 million would be given to members of parliament for purported consultations in our constituencies for removal of presidential limits from the constitution. And there was no emergency.
Are you postponing treatment? I wish the disease would actually fly all the way from northern Uganda, and it goes to these people's families and those people's clans. Then they see the truth of the matter.
Dr. Diana Twine, the author of the contentious letter, says she wrote it before Parliament declared nodding disease syndrome a national emergency.
I am disturbed that some people are saying that I deferred the decision because this letter they were referring to in Parliament went to finance on Monday before even the nodding disease discussion came on the floor of Parliament on Monday.
She revealed that the ministry welcomes the approved funds, but she called for proper guidelines on what they should cater for in order to avoid misuse.
If they want to give us supplementary, we welcome the gesture and we are happy because that's what we have been also yearning for. And we would actually we would advise that once this money is good, finance sends it directly to the districts. However, what I would advise the districts to do is to come up with clear work plan. We need to know what this money is going to be used for, and we need to ensure that accountability of this money, it is done properly. It does not end up like last year's money.
David Bahati, the State Minister for Finance, confirms that his ministry has the money and is ready to release it to cater for the nodding syndrome patients.
Problem eriko okulaba nti tuweereza care abaana ba northern Uganda abasuffering from nodding disease. Iye problem eriko ebirala biveeko tugenda kunoonya sente tuzifune tulabe nti sente zigenda mu district abo.
On Wednesday next week, concerned members of Parliament are expected to visit the affected areas of Omoro and Kitgum. The attention to the nodding syndrome was reignited after NTV aired an in-depth investigative story on the suffering of the victims years after the initial outbreak and government's promises to prioritize their care.